Hello, everyone. My name is Gurjat Basra, and I'm the Manager of Patient Programs, Research and Advocacy at Lymphoma Canada. I am pleased to welcome everyone to the third and final day of Lymphoma Canada's 9th Annual National Patient Conference for Lymphoma and CLL Patients. Our first session today is a panel discussion titled Shared Decision-Making, Aligning Treatment with What Matters Most. We have a lovely facilitator today, Sabina, who will be prompting questions to our panelists and leading today's conversation. So a quick introduction, Sabina Voramiller has a Master's of Science in Clinical Pharmacology and Toxicology and is currently a Doctor of Public Health candidate at the Dalai Lama School of Public Health. She is also the co-founder of the Voramiller Foundation, a philanthropic endeavor to make systemic, sustainable, and meaningful changes to healthcare in Canada, which is very fitting for our session, of course. Sabina has been involved with Lymphoma Canada for nearly a decade, first as a volunteer and then as a board member, and of course, facilitating our panel discussion for years now. So thank you everyone for joining us, and I'll pass the presentation over to Sabina now, who will also introduce our lovely panelists.
Amazing. Thank you everyone for joining us today on a Friday afternoon. And welcome to our first session of the day, focusing on the topic of shared decision-making, aligning treatment with what matters most. Shared decision-making is such an important part of the cancer journey. It's about ensuring that treatment decisions truly reflect what matters most to each patient, taking into consideration things like their goals, values, and quality of life. So today's discussion brings together diverse perspectives from the healthcare team, as well as lived experience, highlighting how collaboration and communication can empower patients and families to take an active role in their care. We're extremely fortunate to have an absolutely brilliant panel joining us this afternoon. So I'd like to quickly introduce our first panelist, our physician, Dr. Graham Fraser. Dr. Fraser obtained his MD degree from the University of Western Ontario and completed residency training in internal medicine and hematology at the University of Western Ontario and McMaster. He is an associate professor in the Department of Oncology at McMaster and a hematologist at the Juravinski Cancer Center, Hamilton Health Sciences, with a CLL lymphoma practice. Welcome, Dr. Fraser. Next, we have on our panel a nurse, and her name is Lisa Boudreau. Lisa comes with 22 years of nursing experience. She began her career as a surgical oncology nurse and has since transitioned to an oncology nurse case manager specializing in hematology at the Juravinski Cancer Center. Recently, she took on the role of lymphoma disease site team co-chair. She's passionate about supporting patients through their cancer journey, providing compassionate care and advocating for their needs. Next, we have the social worker, Sarah Wood. So Sarah Wood is a social worker in malignant hematology program at the Princess Margaret Cancer Center in downtown Toronto. She works with adult patients of all ages and types of blood cancers, admitted to hospital for treatment as well as palliative care. She's passionate about hearing from patients and their families about what matters truly to them as they're living with cancer. And lastly, we have lymphoma survivor Harjeet Kaur. Harjeet, actually, many of you might recognize, she was actually with us on this panel 2 years ago as well, sharing her stories and her experience with us. Harjeet is a stage 4 rare blood cancer survivor and stem cell transplant recipient, diagnosed in 2019 with subcutaneous panniculitis T-cell lymphoma and HLH. After undergoing an allogenic stem cell transplant during the height of COVID in April 2020, Harjeet transformed her survivorship journey into a mission of advocacy and empowerment. Through her digital platform, she amplifies stories of survivorship, mental health, and resilience, with a special focus on the experiences of immigrant and South Asian communities navigating cancer. Welcome to all of our panelists, and thank you so much for being here today with us. So today's session, we unfortunately will not have time to take questions at the end. However, if you do have questions, please do not hesitate to email Lymphoma Canada after the conference is over to follow up on any questions you may have. So the session, building on shared decision-making and aligning treatment with what matters most, this session will explore 3 key themes. The first theme is understanding patient values and preferences. how care teams uncover what matters most to patients and integrate those goals, priorities, and quality of life considerations into treatment decisions. The second key theme is going to be communication, trust, and navigating uncertainty. So, how teams provide clear information, build trust, and support patients through complex or uncertain decisions. And our last theme is going to be around empowerment and advocacy, how patients can advocate for themselves, speak up about side effects, treatment choices, and quality of life concerns, and work in partnership with their care team. So let's start with theme number one, understanding patient values and preferences. And for my first question, I'm going to pose it to you, Dr. Fraser. A big question to start with. But in a busy clinical setting, how do you uncover what truly matters most to your patient beyond the lab results and the medical guidelines?
Thanks so much, Sabina. It's a really important question to start with. I think that is the reality of the system that we work in. It is very busy, often very time crunched, and yet really this starts with finding a way to provide time to be able to ask questions and listen to patients. We actually, we cannot develop a treatment plan without input from patients and their support team, and so it really has to be built into the fabric of the clinical experience. And that might mean that there has to be time scheduled. Sometimes we would even set up extra clinic appointments if there are things that need to be explored in more detail around this sort of aspect, because it can be difficult to accomplish everything all at once. Sometimes it does need to be taken over a period of visits. Now that, of course, sometimes depends on the urgency of the clinical situation, but very often there is time to explore these sorts of the important patient preferences and values that impact clinical decision making. So it's really about building in time and structure to the clinical setting and making it a priority. I think it's also important to leverage the strengths of the multidisciplinary team. I mean, we are not individuals working, it's really not a one-on-one relationship. It's really a patient should, in many ways expect that they have a team of providers that are trying to help them navigate these decisions. So, again, we really do try to leverage the strengths of others on the team. And, the examples of other, kind of healthcare providers on this panel are great examples of that. Our social worker team, our nursing team, because there's specific expertises that individuals have that can also kind of explore a lot of these themes. And again, I think the multidisciplinary care is really kind of what the standard would be in 2025. There may be other areas of support that need to be accessed within the Cancer Center for both patients and families, and recognizing, I think that this often does involve kind of an evolving relationship. It may be difficult on the first encounter to feel completely trusting of the team who's providing care to you, and so I think that there are some situations where it can feel like these things everything needs to be addressed and sorted out, kind of with a sense of urgency. And in some cases that's true. But I think recognizing that there's, that over time, one of the great things about, the work we do is that it is very longitudinal. I have patients that I have looked after since my residency, 20, 25 years ago. This is really about building relationships and trust, and by in the process of doing that, hopefully you get to know patients and families well, and vice versa, and you have this sort of shared trust and be able to incorporate the perspectives of all in the in ultimately in these decisions that get made. And there are many decisions to be made, and so it's just not sort of a one-off kind of exercise.
Speaking of decisions that have to be made, one of the questions, I wanted to ask you was, when multiple treatment options exist, how do you balance the clinical evidence that you see, the data that you have, with, for instance, perhaps a patient's personal priorities of what matters most to them, or their lifestyle, or their needs? And so often they might be the same. Sometimes they may not be the same. And how do you balance that?
I mean, I think the first thing is it is important to make sure that that there's a clear understanding of what really the important priorities and goals are when you're sort of trying to work together to arrive at a decision for treatment. So that may seem obvious, maybe to have the best quality of life and live as long as possible, but there are nuances to that are important to understand. Really, what are the important priorities that a patient may have? We have an obligation to try and make sure that we explain in a way that is in a way that is helpful for that decision making, the risks and benefits of different clinical treatment options. And so there is certainly there is information that has to be conveyed. But oftentimes that does come with different risks and benefits. Now, there are some situations where you're dealing with very high quality evidence and very clear cut, kind of preferred treatments. And there's a decision that has to be made about whether that is a treatment a patient wishes to embark on. And there may be reasons why they do or do not. But then many times in medicine, there are different options that might be good for one or another individual, but involve trade-offs. There may be differences in benefit, but there may be very big differences in risks or side effects. And that's where, again, understanding, I think, patient, priorities and preferences and values is important to be able to understand, kind of how to navigate some of the nuances around these trade-offs and decide on the best treatment option for an individual.
Right. And I think that's where, as you mentioned, that evolving relationship and trust also becomes incredibly important. So thank you so much for sharing that. I'm going to switch over to you, Lisa. I know, Lisa, you work closely with Dr. Fraser as well. And so I guess my follow-up question to you on the same theme is, when a patient is newly diagnosed, how do you help them begin to understand what's most important to them from their treatment? And how do you guide them in shaping what those realistic expectations looks like for their care journey?
I think sort of in my practice and sort of from experience, I think knowledge is power. So providing patients with as much knowledge as we can, and that can either be in verbal communication between the physician and the patient and the nurse going in afterwards, as well as a bunch of written information. And so in that too, thinking about for treatment, is it something that we have to do right away, or is it something that we can do for a watch and wait scenario? And so if they require treatment right away, what does that treatment look like? What do timelines look like? Giving as much information as we can about that. If we're in sort of a watch and wait scenario, what does that look like? And how can I best support them through what a watch and wait scenario would look like? In that conversation, we also ask about what their goals are. So if treatment is an option, what is your goal for treatment? Are you looking for a time frame, life expectancy sort of thing? Or are we looking for sort of quality in all of that, and sort of how can we best support them through that? So we will give our best recommendations, but then at the same time, if their decision follows our recommendations, great. If not, how can we best support them through that? We are big on giving as many teaching materials as we can, and providing teaching materials in verbal teaching and written teaching. If treatments have side effects, what does that look like? And just kind of being upfront with all of that information, that yes, side effects are going to be what you're gonna see, but we're here to best support you through that. What information can I provide about side effects that are expected? And then if they do happen, how can I manage you through that? Also giving patients information for, say, a treatment day. What do your timelines look like? What do wait times look like? What do the wait times look like in chemo? Does a treatment day look like in time frame where, how long are they going to be here? What's that expectation?
Yeah, so that clear communication is incredibly important between you and your patient. Thank you. That's incredible. And then Sarah, maybe I'll pose to you a question on what happens or how do you support patients when their personal priorities conflict with the recommended treatment options? And then how would you navigate that? Just need to unmute.
Yep. Okay. Thank you. So I have the wonderful privilege of working with people often who are newly diagnosed and admitted to hospital when they're starting treatments. So I start off by doing a standard biopsychosocial assessment. So to understand people's living situation and their functional level and their current status, whether they're working or studying or caregiving for others and things like that. So it's just a standardized information gathering, but it's also an opportunity to find out from people how they identify themselves in their lives, according to ages and stages of human psychological development and what's important to them. So it's a really wonderful opportunity to learn about somebody and what matters to them at a time when it really matters. And that can really vary from person to person, um, and and according to their own social identity as well. So if we learn about how people identify socially, then we can support them as a whole human being in their treatments. But I need to position myself about how I do that and how I have that conversation and how I invite that information and how I listen.
Mm.
I also like to separate that information gathering from any kind of decision making, and it should be separate. So right up front, I'm doing that biopsychosocial assessment. I also like to ask people if they can tell me something about themselves that has nothing to do with being in the hospital or nothing to do with a cancer diagnosis. And often they're sharing with me about what they really value. Um, I think it's also important in terms of helping people with realistic expectations. Um, Aligning with the research and the literature, which recommends both living with awareness of the medical situation and living with hope. So people are going to live with dual realities. And we need to invite hope in the conversation when we're talking about serious illness, or we're talking about coping with a new diagnosis and the impact on very practical things like finances or drug coverage or transportation to appointments or looking after kids or looking after elderly people. So when we allow those conversations to be both about the medical situation and hope and what's important to people according to their ages and stages, then it opens up a lot of different possibilities to join in that conversation as a partnership rather than um, people being on opposite sides and having to advocate for themselves. Instead, it's a team approach.
Yeah, I love that. And it's the whole person behind the patient approach. And I think, all of you have sort of alluded to it or mentioned it, but it's the listening aspect that also and is incredibly important. Sometimes we feel that our role is to give the information, but the information gathering, as you say, is just as important. So thank you for that. Harjeet, I'm going to pass it on to you next. When you were first diagnosed, did you feel you had the support and information you needed to really understand your treatment journey and communicate your personal goals and needs to your care team?
Uh, Honestly speaking, no, because I moved to Canada in 2018 and I was diagnosed in 2019. So that part of, just coming as an immigrant and was diagnosed after that. And my diagnosis took 3 months. So I was sick for 3 months and I had high fevers. And every time I used to see my family doctor, I was told that I have fever, viral, or a flu. which will take time and go. And I ended up in emergency several times because I had no idea what to do and, who to talk to. And there were times that I had fevers ranging from 39 to 43 degrees Celsius. And I ended up in emergency a couple of times in a week. And it was just me and my husband, and it was so overwhelming for us because we had no one to talk and we had no family who could guide us. Or also, sometimes you have friends who could guide you to something, but we didn't had anyone because we were just new immigrants. So it was really tough and challenging for us. And it took them 3 months to diagnose my cancer. So we almost gave up hope. I was in hospital for 2.5 months, and I was treated as a research patient because my cancer was so rare that they could not understand what was happening. And when the cancer came in, like when I got the news, it was stage 4. And I was just 32 and I had no clue what to do. We did had a lot of questions because initially we thought, we need to talk to someone else to take a second opinion, because all of a sudden 3 months has turned into stage 4 and we had no idea how. So we did ask our doctors so I was diagnosed in Edmonton, so I was in hospital at University of Alberta Hospital. So my team, they knew that we are having a secondary opinion from our family doctors back home in India, and they were very open to that suggestions because I think they were also not sure what was happening with my case. So I think initially when this all happened, there was a lot of, it was so much confusion, overwhelming, and, we had no idea who's the right person to talk to. But one thing which I think I really want to say, when, Sarah mentioned that, I was not even told that my treatment would cost me tons of, out of pocket cost, which I had to pay by myself. Luckily, I had insurance because I worked with a company where I had insurance. So, none of these things were discussed with me. So when I was going for treatment, after that, we had to pay so much of medical bills for transportation, for parking. And I think it was second month where someone told us that, speak to social worker and they will help you. And that was the time they helped us, explaining everything. But I think as a patient, it's really important. I know as a patient, we go through so much that we don't understand what is happening. But, to a caregiver or to a supporter, you should ask questions. That's one thing which now I always advocate. If you have something in mind, just ask your question or ask questions to your team or your social worker so that, you have that clear mind. And I know as a patient, a lot of things are different when you're going through treatment, but you got to know, if you get to know these things before, it's an easy journey then.
Thank you, Harjeet, for sharing that with us. It really, every time I hear your story, it's just, I feel immensely sad that you had to go through that, and it was such a long journey for you. And looking back, I know you mentioned, the social worker was so incredibly helpful. Would there be, if you had to look back and you had to go back to where you were, what other kinds of support do you think would have been helpful for you at that time, or made you feel more supported or be able to advocate for yourself better?
One was discussing about the fertility loss. There was no one who talked to me about that. And after a couple of chemos, I asked a question, and I was told that, I was so sick that there's no chance. But then after asking, I was actually referred to fertility specialist. So there was no discussion about it, which I still regret. Like, why? This was my life, and this is my, the treatment I had to go through. Had lost, had thrown me into early menopause, and I had no discussion about this. So I had no idea what menopause looked like after treatment. So that topic is very important, and it's sensitive too. As being a 32-year-old woman, at that age, you generally want to have kids, and you're starting your life. But I was just thrown into that without having a discussion. So I think that is something which I really want, that doctors, the team, the healthcare team should discuss the side effects of medication, the side effects of the treatment, what are the long-term side effects, and what I have to go through, because life after cancer is not the same, and it can't be back to normal. It's a new normal we have to accept. So I think all those clarities should be given before the treatment. I advocate because I always see that, we are always treated as patients, but no one sees us as a human being because we have to go through treatments, aggressive stem cell transplant, chemo, and though there are long-term side effects which we have to deal afterwards. Like for me, I see my doctor every year, but still I go through so many challenges every day in my life, which I had no idea. So I think all those things should be cleared beforehand so that patients and their families are ready that, this will happen after treatment.
Yeah, and that's such a great point. Thank you so much. And Dr. Fraser, I want to continue, what we heard from Harjeet and her experience. What strategies do you use to help patients understand the risk benefits and these trade-offs that do exist for treatment options?
Yeah, thanks. It's I think it's a challenging thing because I think the complexity and the pace of change of treatments in lymphoma in general is remarkable. How quickly things are changing and how complex some of the treatments and the trade-offs are. I think it's important though to still try and understand what the primary goals of individuals are and try to understand a little bit about what information is particularly important or what is a priority for them. Sometimes, maybe there's a feeling that you just have to kind of unload this kind of what can be an avalanche of information, and that may or may not be actually helpful for that individual in their circumstance. I do think there's a need to try to really understand what information they need or that they want, and try to layer that into these discussions. So I think from that perspective, I think it is actually quite helpful to ensure, if at all possible, that there are supports that patients have either in the clinic. Try to encourage people to bring in one or many individuals to these conversations so that there can be additional context from family or friends. It helps when patients leave the clinic and have to really think and deliberate on some information that's been provided, or to review information that's been provided if others have had an opportunity also. Again, if that's something that a patient would find helpful. So I think again, these are discussions that require time. I think the treatment, the care team has to really understand information priorities, how best to communicate that information, try to provide that information from multiple individuals and in multiple different ways, involve others to try to help kind of support them in their decision making, and ultimately arrive at decisions that navigate the nuances of these trade-offs in treatment options, so that ultimately the best decision can be made for that individual in their circumstance.
Right, and particularly because there often is quite a lot of uncertainty too that comes into it. Do you find that plays a role in how much information and how you actually address it with the patient?
The uncertainty?
Right.
Yeah,
About
I mean, I
either
think
treatment options or about the efficacy or about safety.
Yeah, I think about this. So the challenge is trying to communicate or apply probabilities of an outcome to an individual who has their future, and that's really difficult. And so it's very common, even after the fact, for people to tell us that their perception was they had X amount of time, or this they were going to get this side effect or that side effect. And really what we're we're trying to communicate these issues at an incredibly stressful and traumatic time. Like how one processes and how one kind of interprets what's being heard in a single moment is very hard to predict, actually. And And so, these discussions often need to happen over and over again and try to emphasize some of these aspects. But, so you have to be honest. Obviously, you want to be transparent and open about, kind of what the prognosis is, open about what the, what potential side effects there are. You want to try to provide some context about the likelihood or severity of specific things. And that also can be very patient specific, depending on their own, kind of backgrounds, their own medical situation and so forth. But at the end of the day, I think focusing on goals is important. So in very often, and again, I don't mean to generalize this, because I fully appreciate that some individuals and experiences are very difficult and challenging. But oftentimes when we're dealing with lymphomas, we're dealing with potentially curative options, and there's going to be some probability of that, or potentially options that have the potential to allow long-term disease control. And again, these sorts of long-term relationships that one has. And so again, if you can bring it back to the goals, our goal in this situation is cure. You're not going to be 10% or 30% or 50% cured. Your goal is cure. We're going to do whatever we can to support this, if that's ultimately what's decided on.
Right.
Or we're going to try and provide the best opportunity for the best response and best quality of life with these, with this particular treatment option. That is our goal.
Right.
And yes, you have to layer in this complex information and try to help them process it, but it is that challenge of trying to think about how a probability of something applies to an individual.
Right.
And try to get some context.
So it's like the population level information, but you're bringing it down to the individual. That's and I totally see that being a delicate balance to manage. So Lisa, I'm going to actually continue this conversation with you, Lisa. When patients then come to see you, and they've come with all of this information, after speaking to the physician about their treatment, and I know you mentioned in the past the importance of information and the knowledge and the education. What strategies do you use to make it easier for them to understand all that information that is now coming their way and absorb it and be able to make some of those decisions without overwhelming them?
I think a big part, and if they're able to, I think a support person being there, whether that's 1, 2, 3, however many their circle would be, because we know in an appointment where you're getting a ton of information that you may only hear one very, very small snippet of what has been told to you, and then you just need those people around you to be an extra set of ears, sort of for listening and hearing some of the things that you may miss. Also, maybe, again, you get lots of verbal information in the appointment, but being able to take some written information home with you that you can then refer to afterwards to go, I think that they said that, but you know what, let me go back and refer in some of the information that they gave us. Yeah, that's right. That is what they told me. Because not everything gets absorbed in one appointment, right? So being able to provide some of that extra information that they can refer to at a later date, and even just information written in different forms, whether it be a booklet or a teaching package or information on specific drugs, kind of thing, that they have different ways of looking at information and absorbing it. We sometimes try to also do a follow-up call, because again, we know we can't do everything in one appointment. And some people can't, are not able to or don't need to make up their minds just in one appointment. So sometimes a follow-up call afterwards, whether that be the next day or a few days later, to say, okay, you took in all of this information. Have you had some time to think about it? Do you have any further follow-up questions, things like that? And I think most importantly, leaving room in the appointment and then afterwards for them to ask any questions that they have, whether that be the patient or their support group, and any concerns they may have of what the decision that they make, what does that mean moving forward? So always just leaving some space and time for them to voice their concerns.
Right, that's great. A member of the audience actually wrote in a comment talking about personalized reports, and again, taking home that information, that written information, as you mentioned, is so important, because then they can refer back to it and have that time to decompress, share it with their families, and come back to you with any questions or concerns that they have. And so, Sarah, I'm going to pass it on to you when we're talking about sharing this information with your families and their families' involvement in patient care. What advice would you give to patients, in situations where the families are involved? And how do you help the families understand what that patient's perspectives are without taking away the patient's autonomy or adding further pressure to the patient's decision?
So all good questions, and there are some different facets to that. In terms of patients' decision making, recognizing that according to healthcare consent law, it's the patient making their own decisions, and that I can't make the decisions for them. I would be breaking the law. And it is the patient's decision. The reality is that often patients make decisions in combination with their families, knowing that it impacts on each other's lives. So approaching from a position of respect, and that people are information sharing about their diagnosis, prognosis, the treatment options that they've heard about and they've learned about, and the decisions that they're thinking about making for themselves. People will not share information if they don't feel safe to do so. And oftentimes people are processing information as they're also processing emotions. And if they don't feel safe to express emotion, then they might not be able to express the information. And so helping people to reframe emotional expression, that tears don't necessarily mean fear or grief or dying. It might be stress, worry, uncertainty, lack of sleep, feeling overwhelmed, exhaustion. And so creating a safe space for that emotion to come out. And sometimes people feel as though they have to really advocate for themselves and that they're in an adversarial position. And so they have to brace themselves to express information and to make requests. Anger is a sign of an unmet emotional need. And so where there is emotion, it's also an opportunity for that to be a person's guide about what do they need. And so if we can talk about that, what's important to people, what's their understanding of the diagnosis, the prognosis, the treatment options, the intention of the treatment as well. Is it remission intention? Is it control? Is it more around palliative care for pain control and symptom management, or is it end of life care? So talking about those things and allowing emotion to be part of that conversation as it needs to emerge, um, can allow people to exchange information, talk about decision making, and move ahead on decision making in their own pace.
So like treating the whole person. So it's not just the physical, it's the mental, the emotional, all aspects of a human, right?
Yeah. And facilitating
Yeah.
communication that's respectful,
Mhm.
but also not pathologizing emotion or the expression of emotion. That tears
Mhm.
don't mean poor coping. Tears don't mean a nervous breakdown. Um, Tears don't mean that somebody's not strong.
Yeah.
And so allowing people to be their authentic selves and to communicate.
Yeah, that's amazing. I love that. And I think that that should hold true for all of us at all times. Um, Harjeet, I want to pass this on to you. So we know that, people from minority groups, from diverse groups, from racialized groups tend to face additional challenges in understanding and navigating their care. And so as a fellow South Asian woman, I'd love to ask you, were there any challenges that you faced particularly, and maybe what helped you feel informed and supported when facing this uncertainty about your treatment?
As a South Asian, we generally don't talk about cancer. Cancer is a huge stigma and taboo in our culture. Um, they say a lot of things that it's related to your bad karma or you've done something bad in your life, that's why you got it. So when I was diagnosed, so honestly, in my whole life, I haven't heard anyone in my family who's diagnosed with cancer. Probably there might be people, but I never heard, and when I was diagnosed, it was tough to make my parents understand, and there were times that, they didn't take the name and they didn't want to talk about it at home. So I had a huge support system. My family flew from India as soon as they got to know about my diagnosis, and there was a deep silence and isolation around this. When I was diagnosed, I was in hospital until my 2 chemos, and then I was sent back home. But they were taking care of me with the food, the medication, which is also, one of the biggest support you can get. But there was so much silence. We never talked about anyone's pain. Cancer doesn't affect you, it affects the whole family, and we never talked about it. And there were times I used to feel isolated because I was struggling mentally. And I knew if I break down or if I melt down in front of them, they might not be able to cope with it. So I had to make myself strong enough for them sometime, but there was no much support outside for South Asians. I understand language, but since I've been advocating, I feel language is a huge barrier when it comes to, cancer in our culture, in our community, because people don't understand those medical jargons. So for me, I joined a couple of support programs and groups when I was suffering in silence post stem cell transplant, because during stem cell, I was isolated for 35 days in hospital with no family member during COVID. And that was the time I really felt that I need to, give back, or probably I might have to write my own journeys to share that how painful it is. And what if I don't make it from here? I want my family to know that how difficult it was. They were there for me, but we never talked. So through that process, I started talking about it more, and I used my digital platform to share my story. And I connected with a lot of organizations thinking that maybe, I might find someone out there, with my own color or a background. But that was a shocking part for me, because when I joined a lot of organization, I didn't see a lot of people from my own color. And I felt that why it's just me in the room. And that's how I realized, and I researched and I dig down deep, and I started, hearing these stories from people when I shared my story on digital platform that, we are not supposed to talk about it. And we are not able to speak about anything, and we can't talk to our extended family. And those stories really, helped me doing what I do now. And since I started talking about it more, I felt that, maybe one person out there from my journey will get hope and resilience, because there are people out in South Asian community or any other community who are suffering in silence, because cancer is such a huge thing. They don't want to talk about it. So I think we don't have much platforms for certain communities. And while advocating for a couple of years, I started my own social media channel, which is Chai and Hope, which is for South Asian cancer community, because I felt, maybe people could connect there and talk to me and share. And that has been doing good, but there's still gap, because I think it's just that you don't hear a lot of voices from our community, and we are so underrepresented because we are not there. So people don't know what's going on with the South Asian community when it comes to cancer.
You're like paving the way for our community, so I can't thank you enough. So thank you for all the work and all your advocacy and everything that you do for the entire community, Harjeet. It's incredible. Okay, we're going to change gears a little, and we're going to talk about empowerment and advocacy, because this is the best time listening to Harjeet's journey to now switch to focusing on the empowerment and advocacy part of our panel. So I'm going to start again with you, Dr. Fraser. We heard from Harjeet, but it's actually a question we get so often from our own community here at Lymphoma Canada, from the folks that we serve. Many patients are worried that asking for a second opinion might offend their oncologist. So from your perspective, how can patients approach a second opinion in a way that feels respectful and safe for them? And how do you support them in doing so while keeping their care plan still on track?
Yeah, it's a very, very common, concern, I think, that is raised. Having, worked with many patient groups over time, I think it's a common area. I mean, my own feeling about this is that there should not be worry about asking for or having a discussion about a second opinion with your physician. Now, I appreciate that the worry or concern that there may be, or that there may be concern about how that would affect the relationship and so forth. I think it is completely reasonable to have a discussion about this. I think it's important to to try and be honest and respectful and transparent about the reasons, because the reasons can be quite varied, and different reasons may be more or less difficult to talk about. I mean, I think there could be a loss of trust in a relationship, and a feeling that the therapeutic relationship is not kind of acceptable or needs to change. It may be simply a matter of understanding that there may be expertise or opportunities at other centers that aren't available in the environment they're being treated. But I think being able to have these open conversations with your physician is paramount to the relationship, the therapeutic relationship. And in many ways, I would say that if that can't happen, that's probably a red flag for the therapeutic relationship and where it is at. I would hope that hematologists would not take offense. In fact, it's actually, I find helpful to know if patients are wondering about this issue. And it invariably is helpful in terms of coordinating a second opinion in a more constructive way. If we're aware of what the issues are, we can help, whether it's by sending information, or whether it's by, even if it's acceptable to the individual, communicating with another healthcare team to to help them understand kind of the circumstances of this, so that that encounter is actually more helpful, that there's not that there aren't any pre-existing biases or other obstacles to getting an effective second opinion. You actually want the second opinion to be useful and effective. And usually the person who can provide the most helpful information is the person who's been looking after you. So it's a bit of a rambling answer, and I apologize. Again, I think this is a topic that should be, that you should feel comfortable openly discussing. I think there are a variety of reasons why that may be requested. Your hematologist can hopefully provide some context on what the utility of a second opinion might be. Because, again, I think it's important to recognize that sometimes there may be very little utility. In other words, I don't think necessarily that every person should be seeking a second opinion in every circumstance. But it is much easier to help advocate for a patient and make their second opinion as useful as possible by being involved in that process. Yeah. And if that's acceptable or possible, that's usually optimal.
Ultimately, everyone wants the patient to feel confident in the decision that they're making for their treatment, right? And that, I guess, is part of that with the conversations and the nuance. Lisa, question for you. Patients sometimes underreport symptoms like fatigue, nausea, neuropathy because they don't want to complain or worry about treatment being delayed or, going off course. How do you encourage patients to share these experiences honestly, because they can very often be quite debilitating?
I think starting with a building and trusting relationship is really important so that they know that they can be open and honest. And I think that starts from the first interaction and the first time meeting, and then doing the teaching with patients, and then afterwards just continuing with that relationship, because we want them to know that we want to know, right? Side effects are to be expected, and we want to know about these side effects so that we can continue to deliver care in a safe manner, and by them feeling like they can trust that they can tell us how they're feeling, I think is really, really important. Explaining up front what to expect, I think, is really important. And then also letting everybody know, or letting patients know, that people react differently to different treatments. And so that if you say, well, you told me I might get this and this, and I didn't, but I did get this symptom instead, we want to know about that, because you never know what that may mean. And we'd rather catch things early and be able to intervene rather than waiting so long. We encourage, or I encourage, that please call me, right? That if you have a concern, you've got a question, there's something that you don't feel like is right, please call me. I'd rather manage that over the phone between your appointments rather than waiting however many weeks it is between seeing patients. That I'd rather know, and that we can help intervene, we can help manage. And even if that just means a quick conversation over the phone to say, yes, what you're experiencing is okay, we can move on, or no, maybe we do need to do something, and just make sure that they know that it's an open line of communication all the time, and we would rather know rather than it being hidden.
Mhm. I love that. That's amazing. I think that is incredibly important, and being proactive is so important too when it comes to care. Sarah, moving on with similar practical themes, how do you work with patients to identify what practical supports they might need that can improve their quality of life during treatment? So like things like counseling, if they need transportation or other community services, how do you identify these and how do you refer patients to them? You're muted.
Keep forgetting about that. Okay, thank you. So that's part of the initial complete biopsychosocial assessment that I do with patients that are referred to me. So I'm assessing for resources that they might already have in place, and resources that might be needed down the road, um, that we can start to apply for, so that by the time they are discharged, hopefully those resources are in place. So identifying in a standard social work assessment right up front, um, if they might have opportunity to apply for income supports. So if they've been working and no longer able to work because they're in treatments, or simply not available because of the diagnosis or treatments or side effects, or the treatment schedule. So we look at applying for employment insurance, sickness benefits. We look at whether they might have any kind of workplace income support program, short-term disability, long-term disability, and illness insurance. I like to leave no stone unturned. So we look at, do they have a mortgage? Do they have car loans? Do they have insurances on those that we can apply for? We also look at drug coverage for prescription medications if they're between the ages of 25 and 65. Presumably, they have drug coverage programs if they're earlier or younger or older than those ages. We also look at transportation to medical appointments, WIGs, if that's a need, support groups, power of attorney, and then in some cases, discharge planning for home with supports, or applying to a rehabilitation hospital if that's needed, or palliative care units, hospices, supporting patients and family members.
That's amazing. So a lot to navigate, basically, and that's,
A lot.
this is why social work is so important. Thank you for that. Harjeet, I'm going to have the last word to you on the topic of empowerment. From your perspective, what does empowerment look like for a lymphoma patient, and how can patients or survivors use their experiences to support and empower others facing similar challenges?
For me, I think empowerment is the more voices you have, the more better healthcare you can, get, I think. And since I would just say, since I've been advocating for my, cancer and my type of cancer, I've just feel the more I have spoken about my journey, the more I have healed during that process as well. And, like as I was listening to everyone, and, because I'm a patient, I have my lived experience as patient, and I've come across so many other patients where they have a lot of disparities when it comes to healthcare challenges, right? And every patient is different, every province is different. So I think the more voices or the more stories we hear from people, the more better we can, manage these things. And for me, I think as a patient, I just feel that as Sarah mentioned, hope is a very important word. And for me, it is the more I talk, the more I'm providing that hope to other people that here I am after stage 4, after stem cell transplant, So there are research happening, there are advancement in the medical treatment, and you need to trust it. It's just that you need to ask questions. You need to make sure that if there is something going on, you have your medical team, you have your family, you have your support people, also communities like you, right? We have organizations like you who are supporting lymphoma patients. So, if they have any questions or concerns, they can reach out to you directly, and maybe you can guide them to a peer navigator or supporter.
Yeah, I love that we're ending on a note of hope. And I think that these conversations are so incredibly important to make sure that we are, empowering our patient community, and also helping them develop that really good and important relationship and trust with their care team, and how to advocate for themselves, especially on critical things that they would need during their cancer journey. So thank you so much to all of our panelists for this absolutely incredible discussion. Such an insightful session. Every year I do this, I learn so much more. So thank you, Harjeet, Sarah, Lisa, Dr. Fraser, for sharing your wisdom, your expertise with our community here at Lymphoma Canada. We're so grateful. And with this, I'm going to wrap this up. And all the participants on this call, please attend our next session, which is supporting the emotional well-being of caregivers. Another incredibly important session. And once again, thank you for being here with us on this Friday afternoon. Take care.